Case of left atrial isomerism with double outlet left ventricle. So in this image, this is subcostal image, transverse plane. So if you, this side is the right side of the patient and this is the left side of the patient. You can see this is abdominal aorta. This is a small portion is abdominal aorta, and this is hepatic vein, or you can say interrupted IVC. So this IVC is interrupted in this case. This is hemiazygous vein because of location in the left side. So this is left side. Simply write this is the left side and this is right side. You can see the stomach. The stomach is in the right side, and whole this portion is liver. So liver is in the midline. This is called situs ambiguous. This is transverse view, subcostal window. Now the next image, again the same thing. This portion is a stomach, this is liver, this is abdominal aorta. Next image. Now you see this is apical 4-chamber view, the color Doppler view. Now the next image. See in this image, you can easily appreciate this is complete AV septal defect. This is right atrium and this is left atrium. This is left ventricle and this portion is right ventricle. And left atrial isomerism, both appendage has got morphology of left atrium. So this is called left atrial isomerism. In case of left atrial isomerism, what we get? Interrupted IVC, azygous or hemiazygous continuation. That is the point. This is moving image. If you look at the you can see in this image, aorta is on the right side, pulmonary artery on the left side. This is aorta and this is pulmonary artery. Turbulent flow is pulmonary artery. So subpulmonary obstruction and hyperplastic pulmonary artery branches. This is the next image. In this image, what you see, this is aorta is anterior, this is pulmonary artery is posterior, and turbulence, you can see mosaic pattern you can see in the pulmonary artery indicating this flow obstruction. This is aorta. The beginning of pulmonary artery and aorta both are parallel. You can easily appreciate in this image. In this image, you can see this is aorta This is pulmonary artery. Aorta is anterior and right sided. Again you see this 4-chamber view. This is unbalanced complete AV septal defect. Again you can see this is right atrium, this is right ventricle, and this is left ventricle. Orientation wise is different. You can see this is left ventricle, and left ventricle is giving flow to pulmonary artery and aorta both. Both are parallel in the initial part, indicating both are parallel related, but mainly both are coming from left ventricle. So double outlet left ventricle with complete AV septal defect, left atrial isomerism, structure wise this is right atrium, this is right ventricle. So that is the point in this image. Now this kind of congenital heart disease is very tough to explain. Anyway, I am trying. Now you can see this is pulmonary artery and this is aorta. Aorta has got no flow obstruction. Same thing you can again see. So this is the case of left atrial isomerism, complete AV septal defect. And pulmonary stenosis. That is the finding. One very important question is how to identify ventricle morphology. This is right atrium. Why? Because IV or hepatic vein is connected to this chamber. So this chamber is right atrium. Obviously when this is right atrium, then this chamber should be left atrium. Then these are two ventricles. This is one ventricle. So right atrium to right ventricle, left atrium to left ventricle. How to identify which ventricle is this one? I cannot say very easily. Motor band or valvular attachment already different in this case. So ultimately we consider it to be same. So right atrium to right ventricle, left atrium, left ventricle, and this ventricle is you see this is the largest part, this largest chamber giving rise to both aorta and pulmonary artery. So this ventricle is called double outlet ventricle. So this is left atrium, this is left ventricle. So double outlet left ventricle, complete AV septal defect, unbalanced variety with pulmonary stenosis. That is the finding overall. Thank you.